Gestalt therapy was developed by Frederick Fritz Perls and his wife, Laura Perls. They integrated elements of psychoanalysis and existential philosophy into a new approach. It is a form of psychotherapy that focuses on the individual's present moment and their relationship with the world around them. It's the concept that a person amounts to more than the sum of their parts. Essentially, it means that there is more to a person than their body, their life, and their past experiences. It is supposed to help individuals resolve conflicts and increase social awareness. It involves the therapist having open dialogue with the client where the client can express their feelings when they are comfortable. It can also involve hands-on approaches and activities. It aims to help clients increase their overall awareness of themselves, their experiences, and their environment to help them accept and grow from their anxiety and depression triggers and from the guilt and regret of unfinished business. Therapists look at how someone's environment affects them and how their history has shaped them without looking too heavily on the past, which is how Gestalt therapy differs from psychodynamic therapy. The ideal recipient is someone who wants to regain their life purpose and achieve a sense of fulfillment. However, it is mostly used for mild anxiety and depression, as people with more intense mental health problems can find this type of therapy to be harmful.
Gestalt therapists focus on processes instead of specific events or experiences. A relationship between client and therapist is built over time and as the client builds trust with their therapist and opens up willingly. The assessments will reveal if the client needs medication or a different therapy. Some techniques include role-playing, the empty chair method, body language analysis, and art. The empty chair method involves the patient talking to an empty chair, creating a pretend conversation between the patient and talking to a part of themselves or to another person. For example, a person can talk to their low self-esteem or their fear of commitment. These conversations are guided by the therapist. A therapist may also analyze a client's body language and ask about the reasoning behind it, since nervous habits, such as foot tapping or crossing of the arms, can theoretically be an indication of feelings that exist in the unconscious mind that present themselves as fidgeting. It can be effective for some people, but the extent of effectiveness varies. There are positive outcomes for depression, anxiety, and relationship difficulties, but it usually is used in conjunction with other therapies. The effectiveness of Gestalt therapy is anecdotal, because it is not proven effective with rigorous studies, but it's based on the success stories of a few individuals or groups.
It is sometimes considered a fringe therapy because some methods can seem unconventional and lack substantial evidence. This is because it is mostly theoretically based and lacks factual support. Some clients may also find this therapy to be too aggressive, but that depends on the individual and their therapist. There is not much monitoring of the interactions between client and therapist, which can lead to some feeling like this form of therapy is too confrontational. Since therapy is considered a healthcare, it is essential to keep it evidence-based. Dr. Judy Ho, a licensed clinical and forensic neuropsychologist, addresses this concern.
Answer one of your burning questions about psychology from Paul in Boston. And Paul says, "Hi, Dr. Judy. I've heard about Gestalt therapy before, but I'm curious. Can it work for people who tend to avoid talking about their emotions or feel overwhelmed by strong feelings? Is it too intense for certain individuals?" Asking for a friend. Great questions, Paul. Gestalt therapy can definitely be intense, but it doesn't have to be overwhelming. One of the core principles of Gestalt is meeting the client where they are. A trained therapist will always gauge your readiness for certain exercises. While the experiential techniques in Gestalt can lead to strong emotions, they are done gradually and with care. For people who tend to avoid their feelings, Gestalt therapy can actually be a game changer. Instead of forcing you to talk about feelings you're not ready to address, it helps you become aware of how you avoid them. This could be through physical sensations, body language, or certain behaviors you might not even notice in yourself. Over time, this awareness helps you connect with your emotions in a way that feels manageable and safe. If you're someone who feels overwhelmed, therapists can use gentler techniques to help you ease into this process. So while it might seem intense at first, Gestalt therapy is really about pacing it right for each person. It can be incredibly beneficial for people who avoid emotions because it actually does not push you to dive into them headfirst. It teaches you to observe and engage with them slowly and mindfully.